Celiac disease is a serious autoimmune condition that affects millions of people worldwide, yet it often goes undiagnosed for years. It occurs when the immune system mistakenly attacks the small intestine in response to gluten, a protein found in wheat, barley, and rye. This damage prevents the body from properly absorbing nutrients, leading to a wide range of symptoms that can affect nearly every system in the body. Today, we're going to talk about what celiac disease is, the symptoms you should be aware of, how it's diagnosed, and how it can be managed to help those affected live a healthy, symptom-free life. Hi, I'm Dr. Knapp, family medicine physician, here to bring you medical information so you can take control of your health and make the most of your doctor visits. Let's get started. Celiac disease is an autoimmune disorder triggered by gluten consumption. Unlike a simple food intolerance, this condition causes the immune system to launch an attack against the lining of the small intestine. Specifically, gluten exposure leads to damage of the villi, tiny finger-like projections that help absorb nutrients from the food. When these villi become damaged or flattened, the body struggles to absorb essential vitamins and minerals, leading to malnutrition and a host of other health issues. Celiac disease can develop at any age, from early childhood to adulthood, and once diagnosed, it requires lifelong management. It is not a food allergy, nor is it the same as gluten sensitivity. With a true food allergy, the immune system reacts immediately, sometimes leading to life-threatening anaphylaxis. In contrast, celiac disease involves a chronic immune response that gradually damages the intestines over time. Non-celiac gluten sensitivity, on the other hand, can cause similar digestive symptoms but does not lead to intestinal damage. Celiac disease can present with a wide variety of symptoms, making it difficult to diagnose. Some people experience primarily digestive symptoms, while others have symptoms that affect other parts of the body. In some cases, individuals with celiac disease may not have any noticeable symptoms at all, a condition known as silent celiac disease. Digestive symptoms are among the most common and can include chronic diarrhea, constipation, bloating, gas, nausea, vomiting, and stomach pain. These symptoms may be mistaken for irritable bowel syndrome or other gastrointestinal conditions, leading to a delay in diagnosis. Beyond the digestive system, celiac disease can also cause fatigue, unexplained weight loss, anemia due to iron deficiency, and bone or joint pain. Many individuals experience neurological symptoms such as headaches, brain fog, or numbness and tingling in the hands and feet. In children, celiac disease can lead to delayed growth in puberty, irritability, and dental enamel defects. One of the more serious complications of celiac disease is dermatitis herpetiformis, a blistering skin rash that typically appears on the elbows, knees, back, or scalp. This rash is caused by the same autoimmune response that affects the intestines and is considered a skin manifestation of celiac disease. Because celiac disease can impair nutrient absorption, it can also lead to deficiencies in vitamins and minerals such as vitamin D, calcium, folate, and vitamin B12. Over time, this can contribute to conditions like osteoporosis, infertility, and neurological disorders. Celiac disease is caused by an immune reaction to gluten, but the exact reason why some people develop the condition while others do not is still being studied. Genetics play a significant role, as celiac disease tends to run in families. People with a first-degree relative, such as a parent or sibling who has celiac disease, have a much higher risk of developing the condition. Certain genetic markers, specifically the HLA-DQ2 and the HLA-DQ8 genes, are associated with celiac disease. However, having these genes does not necessarily mean a person will develop the condition. It simply increases their susceptibility. Environmental factors may also trigger the onset of celiac disease in genetically predisposed individuals. Infections, gut microbiome imbalances, and changes in diet may all contribute to the activation of the disease. Additionally, some people will develop celiac disease after experiencing significant stress, surgery, pregnancy, or another major life event. Diagnosing celiac disease can be challenging because its symptoms overlap with many other conditions. However, several tests can help confirm the diagnosis. The first step is usually a blood test to check for specific antibodies associated with celiac disease. The most commonly used test is the tissue transglutaminase IgA antibody test, which detects an immune response to gluten. Other antibody tests, such as deaminated gliadin peptide tests, may also be used. If blood test results suggest celiac disease, the next step is usually an upper endoscopy with a biopsy of the small intestine. During this procedure, a thin tube with a camera is inserted through the mouth and down to the small intestine, where a small tissue sample is taken. These samples are examined under the microscope to look for damage to villi, which confirms the diagnosis. For individuals who cannot undergo an endoscopy, genetic testing may be an option. While genetic tests alone cannot diagnose celiac disease, it can help rule it out in some cases. If a person does not carry the HLA-DQ2 or HLA-DQ8 genes, it is highly unlikely that they have celiac disease. It is important to note that before testing, a person should continue eating a normal gluten-containing diet. Going gluten-free before testing can lead to false negative results, making it more difficult to obtain an accurate diagnosis. Currently, the only treatment for celiac disease is a strict, lifelong gluten-free diet. Even small amounts of gluten can trigger an immune response and cause damage to the intestines, so it is essential to completely eliminate gluten from the diet. This means avoiding all foods containing wheat, barley, rye, and any products made from them. Common sources of gluten include bread, pasta, cereals, baked goods, and processed foods that may contain hidden gluten. Reading food labels carefully and looking for gluten-free certifications can help ensure that a product is safe to eat. I just want to take a moment to ask that you hit that like button and subscribe to my channel. Leave a comment below if you have any topics you want covered in future videos. Anyway, cross-contamination is another concern for people with celiac disease. Even a tiny trace of gluten from shared cooking surfaces, utensils, or fryers can cause a reaction. It is important to take precautions when preparing food, such as using separate cooking tools, avoiding shared condiments, and being cautious when dining out. Many restaurants now offer gluten-free options, but it's always best to ask about preparation methods to minimize the risk of accidental exposure. In addition to dietary changes, individuals with celiac disease may need to address nutritional deficiencies caused by poor absorption of vitamins and minerals. A doctor may recommend supplements for iron, calcium, vitamin D, vitamin B12, or other nutrients depending on blood test results. For those with severe intestinal damage at the time of diagnosis, it may take several months to years for the gut to heal completely. Symptoms often begin to improve within weeks of starting a gluten-free diet, but full recovery varies from person to person. Regular follow-up appointments with a healthcare provider and repeat blood tests can help monitor progress and ensure the intestines are healing. With strict adherence to a gluten-free diet, most people with celiac disease can live healthy, symptom-free lives. However, if left untreated, the condition can lead to long-term complications, including osteoporosis, infertility, neurological disorders, and an increased risk of certain cancers, such as intestinal lymphoma. Ongoing research is exploring potential new treatments for celiac disease, including enzyme therapy, medications that block the immune response, and even vaccines that could help people tolerate gluten. While these treatments are still in development, they offer hope for a future where managing celiac disease may become easier. Celiac disease is a serious autoimmune condition that requires lifelong management, but with the right knowledge and support, individuals can successfully navigate a gluten-free lifestyle. Recognizing the symptoms, getting an accurate diagnosis, and strictly avoiding gluten can help prevent complications and improve overall well-being. If you suspect you or a loved one may have celiac disease, it's important to speak with a healthcare provider to get tested and start taking steps toward a healthier life. Thank you for watching. As always, take care of yourself and make the most of your day.